Let's speak also now to Dr. John Puntis, who co-chairs the Keep Our NHS Public campaign and is a retired NHS paediatrician. Good morning to you, Dr. John.
Good morning, Paul.
Dr. John, Dr. Puntis.
Dr. John is fine.
Thanks so much for joining me. So where do you stand on all of this? Because obviously you've worked in the NHS, you've been a doctor yourself. Do you still have sympathy with striking doctors, given that this is really dragging on now and this is going to be a record-breaking 5-day strike?
Yeah, I do have absolute sympathy with the junior doctors, and of course the nurses and other healthcare staff who've been under enormous pressure for a variety of reasons, not just COVID, but also the sort of massive workforce gap that we have with 140,000 vacancies and about 8,500 doctor vacancies, putting extra pressure on people. And 35%, it sounds a lot, but you know, if you have your pay cut by 25% and then you say, can I have that 25% back? That actually means a 35% rise to get back to where you were.
I suppose though, John, it's the fact that across the economy, everyone's had a real terms wage cut, or the vast majority of people have really over time. Real wages have been eroded across the economy. So I get the argument that junior doctors are making. It's just that nobody else has really been able to make that argument in their sector. So it's that comparison, isn't it? People don't think that it's comparably fair for doctors to get 35% when, you know, other people are settling for around 5%.
Well, I think 35% is a negotiating position. It's not completely inflexible, and I think, you know, it helps other workers if the juniors were to get a substantial rise above 5%. You know, that sets a precedent for other workers, and that's not a bad thing. I mean, there is a general crisis in terms of health service staffing in many European countries. The World Health Organization have said that this is a huge challenge. In fact, what it said is we cannot wait any longer to address the pressing challenges facing our health workforce. The health and well-being of our societies are at stake. There is simply no time to lose. You know, we have to do better at retaining staff, and we have to do other things for staff as well. We have to look after them, show that they're appreciated and cared for, provide occupational health, psychological support at work, make sure that their working conditions are not appalling, which they are in many situations at the moment. So there's many things that government could do. And NHS providers are absolutely clear that the reason for the huge waiting list that we have of 7.4 million is lack of staff. It's not strikes. The strikes will make things worse, no question, but they're a drop in the ocean compared with the problem that's caused by underinvestment, lack of planning and lack of workforce plan.
But it won't feel like a drop in the ocean. If you're someone waiting for an operation and it gets cancelled next month during these 5-day strikes, you're going to feel incredibly disappointed, if not worse. Do you worry that maybe public sympathy is going to start running out here? Because 5 days of strikes and then followed potentially by 2 days of consultants on strike as well is going to really punish people, and maybe the public will lose their patience with all of this.
Well, that remains a possibility, but I mean, the Ipsos Mori poll in April showed that 54% of people supported the junior doctors in taking industrial action. I was on the picket lines for a couple of hours each day for 3 days last week, and public support seemed very strong. If you judge that by people hooting their car horns, there was virtually no car that went past without hooting. There was also a huge appetite for taking leaflets about the crisis in the health service from people going past. And there were lots of junior doctors on the picket line who were saying support remained very strong. At the end of the day, you know, good patient care depends on having the correct number of staff, safe staffing, and a well-supported and contented workforce. And of course, individuals will feel terrible about it. But it's been interesting that in some places, patients have actually come out and joined the picket lines and said, we support you.
All right. Very interesting indeed. Dr. Puntis, thank you so much for your time this morning. That was Dr. John Puntis there, co-chair of the Keep Our NHS Public campaign and a retired NHS paediatrician, talking about our main topic this hour, that junior doctors are going on a 5-day strike. Do you